Progressive States Network, where I work, we're in a unique position of working in partnership and with state legislators across the country. And in terms of healthcare, we have over 1,000 state legislators who believe in comprehensive healthcare reform. And regardless of what comes out of D.C., this is only the beginning. It's not the end all and be all, because yes, it's a huge lift for the president and for Congress to get this bill passed. But even a bigger lift than that is, once it does pass, how will it be implemented? And that's going to be a huge, huge issue for all 50 states as well as the federal government.
Well, just talk about that a little bit, because that's one of the aspects that people aren't grasping, I think, most of us, in the sense that where's the wiggle room? Why will implementation be so up for grabs? Isn't it a federal bill with federal mandates?
It is, but let me give you one example. There are provisions in the federal bills for insurance companies to be able to sell policies across state lines. And on paper, that seems like a good idea, but unless you have very strong consumer protections included in those selling of policies, it's going to be, quote unquote, a race to the bottom. So insurance companies will take up offices in states that have virtually no regulations in terms of consumer protections, be able to sell policies to people in states with, like New York, stronger consumer protections, but those won't apply because the rules of some other state will take precedent. So that's a very, very tricky...
so that brings in both Anne and your issue, Chris, in the sense that consumers who fought for coverage for contraception, say, in California, could find themselves being offered as their only available health care plan something from Mississippi that never covered that provision?
Well, this is why it's so important that everybody be in. And there's been a lot of concern about the mandate, and one reason why AHIP raises their rates by so much is because they are concerned about cherry picking. They only want to insure healthy people, which leaves then government and others to cover the poorest. That is not a winning solution for people who care about costs. And so one reason why we supported a national exchange where consumers who want to buy their own insurance could have just a few plans that were simple in plain English. To go to 50 state exchanges, we're concerned about what that's going to mean for consumers having real choice. It goes to the points that Enzo was raising.